Excellent. So we'll go ahead and call this meeting of the Health Policy Committee to order, and we'll do a roll call. Can you do that, please, Carissa?
Sure. Ms. LaFrance? Ms. Quinn Davidson?
I'm here, thank you.
Ms. Allard? Mr. Constant? Mr. Dunbar?
Here.
Mr. Rivera? Ms. Zolotel?
Ms. Zolotel, she was today. And I see on the list, so I think they're here.
Hi, this is Suzanne. I am here, just having audio problems. Can you hear me okay?
Yes.
Thanks.
And I see Mr. Rivera also on the list. Are you here?
Present.
Okay.
Yeah, this is Cameron Perez-Reddy. I'm sitting in for the first part of the meeting, but I'm going to have to jump off in about a half hour. Thanks.
Hey, Cameron, thanks for joining us.
Sure.
Well, let's go ahead and get started. Today, we're going to spend our time talking about the alcohol tax and what we could use this new source of revenue. Just want to thank everyone who supported us in getting to this place, and also the voters of Anchorage for having the vision to create this fund and to make some positive difference in our community. So I'm going to go ahead and turn it over to Ms. LaFrance, who's just going to give some opening comments, and then Ms. Pineda before we have our speakers start.
Thank you, Madam Chair. And thanks to all the participants and members for joining this discussion. The forthcoming alcohol tax gives us a really unique opportunity to implement programs that support the health and wellness of our community. And so often we find ourselves reacting to issues related to homelessness, drug misuse, and crime by allocating resources that address the immediate crisis, but don't address the root causes of these big social problems. Even though we have the expertise in our community to address root causes, and we know that prevention and early intervention can save money, estimates are as high as $10 in savings for every dollar invested. Until the alcohol tax passed, we lacked a steady funding stream to support a broader approach to tackling these big issues. So here in the Health Policy Committee, we are working to better understand prevention and early intervention opportunities in the municipality of Anchorage in order to ensure policy-making decisions are informed. We have invited key stakeholders to share with us the work and services that would help in prevention of child maltreatment, sexual assault, and domestic violence. The two goals of this session today include the first, to describe the importance of prevention and early intervention for youth, families, and educators in the municipality of Anchorage. And the second, to learn about the programs and services in our community related to prevention and early intervention for youth, families, and educators. So each speaker, except the first, will have 5 minutes and will give a brief overview of data in Anchorage and what we know from studies, and will share their perspective on why prevention and early intervention is a critical investment, and what types of prevention and early intervention services are being provided or could be provided with resource investment. And we are particularly interested in partnerships and leveraging of funding costs and outcomes. So thank you again for all being here, and thank you, Madam Chair.
Thank you, Ms. LaFrance. Appreciate those comments. Ms. Pineda, did you want to say some words before we have our presenter start?
Sure. I would just like to say thank you to the Assembly. I know, I think this is maybe the third meeting over the last 3 weeks where we've had the opportunity to talk about the importance of prevention, of preventing adverse childhood experiences, of thinking about how we can carefully make an investment in our community for the long term. So I really wanted to applaud you for taking the time to continue to listen and learn from our department, but also now from our community partners. And I'll just leave it at that so we can spend as much time with our community partners. Thank you.
Thank you. Dr. Parrish, are you ready to get going on your presentation? And you have about 10 minutes.
Yep, sure. Let me share my screen here.
And before you get going, I just wanted to say thank you. I wasn't there at the Friday ACES training, but I've listened to it. I listened this morning, and I really appreciate a lot of the data that you presented and look forward to how this ties in.
You're welcome. Are you seeing my screen okay? Just want to make sure.
Yep.
Okay, great. Thank you for the opportunity to address you guys. And just to be clear, this is a 10-minute presentation that usually takes an hour. And in an hour, we barely even touch the surface. So you're getting just like some boiled down key components of it. But I'm going to take the time just to talk about some information and data that we have from the Alaska Longitudinal Child Abuse and Neglect Linkage Project, which we call ALCANLink, which is a unique data source that we have here in Alaska. And I'm going to focus on how we can utilize the information derived from this system to address ACEs in Alaska and inform our decision making. So just real briefly, what the ALCANLink study is, it's a mixed design study where we've integrated the PRAM survey, which is delivered to a representative sample of live births that occur in our state each year, that's integrated with a 3-year follow-up survey that we conduct of the same respondents, as well as multiple administrative data sets. So what we've done is we've taken a cross-sectional study of our entire population and turned it into a longitudinal prospective cohort study so that we can look at the effects of different responses in the environments over time. Now, the motivation for the ALCANLink project was really built on the life course perspective in this theory and the research that supports that there are a variety of assets and deficits that impact our health trajectory over time. And that early on, during our early childhood, we're forming a lot of our formative years and our health practices and our social and behavior learning is occurring, and that timing of prevention and interventions can have differential impact on changing the course of a trajectory. And so there are these assets that bolster up and help support our health trajectory, and there are these deficits that impact or reduce our overall health trajectory. And so to be able to understand these assets and deficits over time, we needed this longitudinal data source, and that's why we developed this ALCANLink project. Immediately from this project, what we determined and learned that there are a lot of children in our population that are likely operating with multiple deficits that don't optimize health and development in their household, as evidenced by noting that 1 out of every 3, 1 out of every 4, 1 out of every 8, and 1 out of every 16 kids that are born in our state will be reported to Child Protective Services, screened in, substantiated, or removed from their home before their 9th birthday. These numbers were quite startling. We saw that and we realized that this is something that a lot of children are experiencing, and this is an indicator that there's something potentially going on in the home that isn't going to support their optimized health trajectory. As you guys learned about last week and have probably were familiar with before, the adverse childhood experience is another way to think about it, just and not only looking at reports or substantiations by child welfare, but looking more at the context and where that child is living and learning and thriving. And the adverse child experience is done multiple decades ago now. They boiled it down into abuse, neglect, which can be conceptualized as events that child they themselves directly experience, and then household challenges or where that child is actually being reared and growing. And the accumulation of these factors were associated with multiple negative health outcomes. And so looking at that construct of adverse childhood experiences, we can actually break that apart a bit. And we can look at the household construct and household challenges that were present before the child was even born, and how those predict abuse and neglect or contact with child welfare. So we utilize the ALCANLink data to look at the environment of that child before they were born, and then contact with child welfare. And what we found wasn't surprising, is that the risk of contact with child welfare systematically increases with the increased number of pre-birth household challenges that the mom specifies she experienced, which include things like mental illness, incarcerated relative, mother being treated violently or intimate partner violence, substance use, and divorce. We further looked at, instead of just looking at whether they were reported to Child Protective Services, looking at these household challenges before the child was born, and then looking at the average child ACE score that we were able to calculate or derive by their 3rd birthday. So to calculate this ACE score, we combined the information from our 3-year follow-up survey plus the administrative records through the child welfare data to come up with this score. And based on the research from Dr. Finkelhor, we included another component to this construct, which is financial stressors that can be highly associated and impact a lot of negative health trajectories as well. So we built up this construct a little bit more. And what we found, again, wasn't surprising. for each additional pre-birth challenge reported by the mom, a systematic relative increase in the average childhood ACE score was observed. So there's this real clear link now between intergenerational transmission, that the household that exists before the birth is going to continue on, and just adding a new child into that environment is really going to be indicative of their health trajectory. So what we did at the next level of this was we really broke apart and we looked at, during that pre-birth window, if you were born into a low-risk family, so a low number of household challenges reported by the mom, so 1 or fewer, and then a higher risk household so if you were born into a household where a mom reported 2 or more household challenges. And what we found among our low risk group is that if the mom during early childhood reported an increased number of those family challenges, the exact same ones, if that increased, the risk of being reported to Child Protective Services increased by 140%. So their risk substantially increases. If we look at the high-risk group, if they were in this high-risk household, and then the mom reports a fewer number of household family challenges, the risk of being reported to Child Protective Services decreases by 43%. So this is just a really quick snapshot of where we're actually showing that if we improve the household functioning before a kid's even born, it will have a direct effect on children being reported to our system and needing those resources, at least by age 3, where we have the data to support that. What's really important to realize that when we look in the stratification of the low risk and our high risk group, they have different components that make up the risk strata. Most commonly what we're seeing in the low risk group are stressors that they're experiencing or challenges in their home that may have a lower probability of resulting into trauma that is really what's indicative of causing these negative health effects. But among our high-risk group, they're experiencing much more traumatic experiences like intimate partner violence, homelessness, drugs, and depression. And those are really interconnected with a lot of other factors. And a lot of research has showed that these ACEs or these constructs tend to run in packs. They cluster together, and more so for these ones that are really substantial, like intimate partner violence. So I just wanted to show a quick example of the interconnection of factors. So here I'm just looking at children who are born to mothers with indicating they have depression or anxiety. What we know from kids that are born to that, if we look longitudinally along their history, 62% have impulse or emotional control problems in kindergarten. 77% of them have poor 3rd grade reading scores. 44% of them will have a report to Child Protective Services before their 8th birthday here. They have an ACE score that is twice as high as those who are born to moms without mental illness. And they have over 3 coexisting stressors. Now, those coexisting stressors is really important when we think about the construct of prevention. So what are those likely coexisting stressors? Well, what the research shows and what our data here in Alaska show is that often these stressors of mental illness coexist with intimate partner violence, incarceration, substance use, and financial challenges. The implications of this is that if we address one of these singly, and our goal is to improve or reduce ACEs or improve the well-being of the family, we need to understand the interconnection between all these and how we're a part of the cog and a spoke of a wheel to lead to ultimate improving that environment where that child's being reared. So what these data suggest, to wrap up, and I know I just blasted through that, is that preventing ACEs begins before birth. And there's an intergenerational transmission, a connection to this. And what we do early on has a substantial and impactful change in the health trajectory of a child. Being trauma informed, we hear that a lot. It really begins with you. And by you, I mean us and all. I strongly feel that all elected officials should participate in the Strengthening Families training. Then you would start seeing the connection that any policy decisions that are made may have an impact on adding to benefits or assets, or could contribute to deficits that we might not even have thought about. We need to support pregnant women, parents to build environments that maximize learning and development. The government can't really replace the home. What we can do is we can support the home, that it can then maximize the health and development. But to do that, we have to address trauma through strength-based approaches. We have to address mental health and substance use by making sure services are available and that they're used and accessible. We need to ensure resource adequacy and housing is available, and that includes making sure we have affordable child care. And we need to support educational attainment of the caregivers. That's a really strong independent associative factor. Furthermore, the research in Alaska shows that we need to have medically accurate, age-appropriate, comprehensive health education. That includes showing and documenting what healthy relationships look like, what they are and what they are not, so that they can have that patterned behavior, and how to learn and develop self-regulation skills as challenges occur and as they are faced with new challenges over their life. Being able to self-regulate, help them cope with those new challenges. And then finally, the data strongly support that comprehensive and coordinated prevention efforts are needed, that we can't just fund one siloed thing and assume it's going to affect adverse childhood experiences. We need to have everyone who's addressing these major components of these constructs working together and understanding how they're a part of improving that household collectively. So with that, I think I've went over my 10 minutes, but thank you so much, and I'm excited to hear from everyone else.
Thanks so much, Dr. Parrish. And as my colleagues are aware, if they have questions, they can just let me know in the chat that they'd like to ask. I don't see any questions, so I think we should just go ahead and move on to Stephanie Berglund, the CEO of Thread. Oh, there she is.
Hello, everybody.
Hi. And before you get started, Stephanie, I just wanted to say that Suzanne and I put a lot of work into organizing this, and we're so glad to see all of you here and thank you for everything you're doing in the community. And unfortunately, I only have 5 assembly members on the phone right now. And as you know, there are 11. So there's a big story to tell, and we don't have them all here. And I'll probably just ask you to, either in partnership with us or on your own, please help tell that story to them whenever you have the opportunity. And we'll really need them to absorb all of this, whether they're participating in this committee meeting or not, in order to get their support moving forward in allocating appropriate amounts of the alcohol tax revenue toward these types of services and programs. So just a plug to this is just the beginning of telling your story. So go ahead, Stephanie.
Great. Thank you so much. Thank you. And thank you to all who are on the line today, both elected officials and community partners. I really appreciate the time to focus on prevention. I know there's many opportunities with this tax initiative, so appreciate your leadership and support, really, to gather information on potential investments and also with a lens of strengthening our community. So I'm Stephanie Berglund, the CEO of Thread, and for those of you who don't know, we work across the state to increase access to affordable and high quality early childhood education and specifically childcare. We're a private nonprofit that have been working for over 30 years, providing services to families, to early educators, to the early childhood education programs and communities, all with focus on, again, strengthening early childhood and healthy development for our youngest Alaskans. So I want to just talk a few minutes about why quality early childhood education programs are so important. They are important for a strong foundation for our children, for our families, and ultimately our community. So I like to talk about investments in early childhood as true prevention, and they're a 2-generational approach that over time can make great difference. They support, of course, our existing workforce. We're hearing about that conversation now related to COVID, but under normal circumstances, their early childhood education programs are a critical support to our workforce, our working families who are working toward more self-sufficiency. That, of course, helps them have stronger income potential and ultimately creates a stronger economy for all of us. And then, of course, the benefits of our young children and how they benefit from quality childcare and the needed supports that Jared identified. We know that children who have access to quality early childhood experiences and have opportunity for that healthy development, help support their brain development at a time where their brain is developing the most. Those who have those quality experiences early on have more positive outcomes, both in terms of their health and learning. We know there are times with peers and positive adults helps them with positive interactions, help support that key executive functioning that we all use for decision making, friendships, social skills that we know are so important in problem solving. It connects families with the parenting supports that they need. It helps relay best practice in how children learn and parenting techniques and supports. And I think most importantly, it helps with early intervention. It helps with the data that Jared was just talking about of how do we identify the needs, the gaps, the ACEs supports that we need to put in place. And intervening early is more effective and far cheaper than supporting special needs when children get to school. So I think many of you have heard research over time, but wanted just to highlight again that quality, early childhood experiences, whether it be in childcare or pre-K in another program, ultimately has huge impacts on a child's school experience. It reduces referrals to special ed, reduces rates of grade retention. We see higher school achievement and then higher high school graduation rates. And then long term, of course, this loops into the whole 2-generational approach idea that, of course, they become more employable. We're seeing increased earnings, reduced rates of criminal activity, reduced rates of teen and single motherhood. So all of the ills that we would like to see in our community. So THREAD is encouraging that the tax revenue be used to strengthen quality early education in Anchorage. We know that through coordinated efforts, we can strengthen prevention in our community by meeting children and family where they naturally are. As families are participating in the workforce, we know that they're already utilizing community-based childcare and pre-K. So we can build off of the successes we have while looking at innovative strategies to meet both immediate needs and creating a web of really preventative supports that will ultimately change our community as a whole. So there's many options. I'm happy to provide those. I know it's a short time today, but happy to follow up as you recommended. But some initial ideas are investing in families. We know that they need more parenting support. We could benefit from training and education. There's financial supports we could invest in, such as helping them access quality early learning, if it's through scholarships or vouchers, or even free resources like free universal childcare or pre-K. We also can be investing in community early childhood education programs. We can be investing in more quality childcare. Again, building off of our successes, there are existing quality programs in our community. Juno and the Hearts Initiative is a good example where local investments are being having great return on investment with their early education workforce. We can be investing in pre-K. I know Chelsea's going to talk next, but we know that through our Title I schools and those families are most in need, and we have a huge wait list in how we can be investing in more pre-K in our community. And then support for early educators, childcare teachers. There's lots of opportunity to help them with curriculum, healthy interactions, training on ACEs, trauma-informed care. There's lots we can do to support our early educators and being more equipped to meet the demands of children and families. And really money to support incentivizing programs. We have a huge access need in our community, and it's really expensive to start a child care program. We're seeing how expensive it is now to be, continuing to offer those services in difficult times. And so we need more of those community options. So providing business incentives and supports for more to be providing that care is important. So I'll just close by saying that more than siloed investments, I know you're going to hear from a lot of us today. I really want to encourage you to continue with your research and decision making to consider bringing us all together. This is a great group of presenters, and we all have meaningful work happening in the community. And I know together we can, potentially develop a stronger, more comprehensive recommendation of how to best utilize the funds in conjunction with the municipal health department. So we want all to effectively use this new resource and want to be thoughtful of a long-term plan that will strengthen Anchorage, not only now, but long into the future. So I'm happy to be a resource and answer any questions. Thank you.
That's great. Thank you so much, Stephanie. Really appreciate that. And yeah, just to sort of frame a little bit where we are, we had a work session together as the assembly and then divvied up into committees, as I think all of you know, the Health Policy Committee to talk about these types of issues, the Public Safety Committee, and then the Homelessness Committee. And so each of those committees will, to some extent, be vying for funding to accomplish goals that they have within their committees. And I think it'd be really useful. So we don't get the, this committee doesn't get the final say. And so it's hard for all of us to have a strategic vision that we know will be implemented. But I think it makes sense. And we'll be talking about this next month too. So between this month and next month, working together to develop what is our strategy and how do we put forward a plan using all of your expertise that really shows the rest of our colleagues how effective that would be and why it's the best use of the money. So I really appreciate you raising that. I appreciate your specific examples. I think those are the kinds of things we're going to need to share with our colleagues with funding amounts. So thank you for that. And we'll move on now to Chelsea. I'm so excited to hear from Chelsea. We know that it kind of all begins with kids. And so go ahead and talk with us.
Can you guys see my screen? Okay.
Can.
Just wanted to make sure there. I'm used to using Zoom instead of Teams. So I'm just going to talk as quick as I can to get through as much of this. This is just some outline notes about our programming and the gaps that we're seeing, as well as some struggles that we're facing that, a lot of that comes down to our state funding. We've had grants in and out for many years in ASD, but we've also been able to expand. So I'm going to go through this quickly, and then I can definitely provide this to the group at any point at the end, so you don't have to worry about remembering any of these numbers. So currently, ASD has gen ed preschool in 22 schools. To keep in mind, that's just one classroom per school, and I'll go over the mix here, but we have over 60 elementary schools. So 4 of those 22 are collaborations with Head Start. 3 of those 4 are in Title I buildings, but all the children in the programs have to meet Head Start eligibility requirements. And then out of the 22, we have 10 Title I sites and 9 that are non-title. And we were just able to move into the non-title this school year with a big grant that we got from the state that provided for inclusive programming. So we serve at minimum 5 children that have special education needs in a general education preschool. And we don't have inclusive opportunity in our system right now. So that's the max that we have on that one. We serve 17 children with a certificated teacher that has to have credentials in early childhood education, a teacher assistant, and then the programs are all supported by coaches, a care team teacher, which is a special education teacher that does itinerant services around to the programs for children in need, and then a part-time early childhood specialist who is Beth Snyder, if many of you have worked with her over the years. So total, our programs serve 374 children. And to put that into perspective, there's about 3,000 to 4,000 children per grade level in the district. So we're at about 10%, you could say, of incoming kindergartners that would be coming through our programs, not including, other preschool programs in the community, such as Head Start, et cetera, or private preschools. So in our programs, we do prioritize children that have at-risk factors that relate to homelessness, trauma, developmental concerns, struggling family structures, hardships, etc. We try to get our highest needs kids into our programs because we know that they are the most at risk and are going to be the farthest from those 3rd grade reading milestones. So this is just a tiny piece of a document that provides to some conversation around some of this earlier this school year. So the last ADP, which was the 2019 results, this is 19% of incoming kindergartners are meeting all 13 goals on the developmental profile. The 2020, I just looked that up and it was 18%. And I would expect that to go down in the fall due to the closure this year. Like I said, we serve 374 kiddos in our programs, about 10%. And last year's wait list, we had 470 active on the wait list, meaning families, I weeded out families that had applied for multiple programs or had declined. But we had over 1,100 applications for the 374 slots. So a few facts: children, and Stephanie touched on this, that attend a high quality preschool are more likely to graduate from high school, and they're less likely to need special education interventions, be arrested, require social services later in life, be retained in a grade, and be suspended from school. Children attending in our Title I programs outperform their peers in kindergarten, and therefore they're more on track for third grade reading proficiency. And they do typically enter behind with a lack of language skills. So our programs are, language is a high priority for us. There is a lack of peer socialization for children due to family and community violence in Title I neighborhoods prior to COVID, of course, and we would expect to see an increase in this trauma-related behaviors, et cetera, as we're coming into the fall. And of course, it's going to depend on what our fall programming can look like with everything. That takes a toll on young children's overall development, and especially in mental health. So with Alaska being one of the highest nationally with child sexual abuse, our preschool teachers, they really work to help kiddos identify their feelings and how they can pay attention to them, to trust caring adults, tell teachers when they are confused about their feelings, especially around touch. No means no. We have how-to picture books. We use a social emotional curriculum called Second Step, and we provide resources to families for early intervention or identification. Our teachers are trained in strengthening families and have had ACEs training. And then we have preventative programming that focuses on social, emotional, and kindergarten readiness. So essentially, when a child is exposed to a chronically violent, abusive, or neglectful home environment, their opportunities for play are not nearly as much as those children that are not. So our programming helps foster that environment for them. This school year, we had a mental health consultant, and this is a pilot grant from the Mental Health Trust in Anchorage, or in Alaska, sorry, the Alaska Mental Health Trust. We have a consultant that works directly with teachers and provides supports to families, all the way from we start at the classroom level, and then we can work all the way down to the individual family level. This is only in 3 schools out of our 9 or 10 Title I schools, so it is not super widespread. And those acronyms there are Fairview, Mountain View, and Willowa, so 3 high needs Title I schools that receive this service. We are expanding into Northwood, which is over in Spenard, and are pretty excited about that. We got a continuation with the Alaska Mental Health Trust. I'm going to go quick. We have seen an increase in children qualifying for special education over the last 3 years. More kiddos as well as their intensive needs have gone up. So our current general education classrooms help reduce the number of children qualifying for special education because of that early intervention. So currently, children that are attending our preschool programs go for 4 hours a day, which would equal 648 hours of learning prior to kindergarten. And again, focusing on that social emotional development, reducing their stress, early intervention. We do home visits at minimum of twice a year. And these provide more inclusive opportunities for children with special needs in the gen ed setting. So it's reiterating the need for that inclusive environment. So if we were to look directly at costs, as Stephanie talked about needing more preschool in our higher risk areas in our Title I schools, since we only have 1 classroom in some of our Title I schools right now, here's just kind of a breakdown. So staffing for a teacher and a TA with benefits is about $150,000, and then it's about $25,000 for a startup classroom for materials, furniture, and supplies. There are 20 elementary schools that are qualifying for Title I right now, and we would need 2 to 3 classrooms per school. So that could range from $350,000 to $575,000 per school to meet the need of children not attending in a Title I community. And this would also assume that we would not have any overlap with children that would be going into Head Start program. And we like to partner, not compete for kids. So it would be about $11.5 million if we were to say 3 classrooms per school here. versus if we were to go universal in Anchorage, we would be looking at about 49 million to put 2 to 3 classrooms in every elementary school. And then my last point here would be that our state grant money is really not available anymore. We had $1.6 million for programming that will now go down to $150,000 next year. So we're definitely at risk of losing about a third of our programming in general education preschool because of that. So there's a huge need and there's a big gap that the district is not able to serve right now. So we are fully in support of this funding as well as partnering on whatever we really can do to get the most out to our kids and to our community.
Thanks, Chelsea. That was really helpful. So were you talking about only kids who are pre-kindergarten, like the year before kindergarten?
Correct.
Okay.
Yep.
Thank you. Mr. Dunbar had a question for Stephanie, and I neglected to call on him. I'm sorry about that, Mr. Dunbar. Did you want to go ahead and ask your question now?
Sure. I think it's partially been answered, but I always look for the chance to ask it again. For one thing, she's here, and I'm wondering if she has any new ideas on how to spend, 20 or $30 million of CARES Act funding, although I know that is sort of outside the realm of this particular meeting. But again, you sort of answered this, but could you be a little more specific about, let's say you had $1 million or $1.5 million, how would you deploy that going forward? Like what exact mechanism would you use?
You're looking for the silver bullet, and I don't know if I have that. I was going to say that's not really fair. To answer your first question, thank you, Assemblyman, about the CARES dollars, that yes, THREAD is advocating to all municipalities across the state that they allocate a portion of their CARES dollars to support community-based childcare. And we are ready to send the letter to you all tomorrow. So you'll be receiving that, and we do provide recommendations of how much of that allocation, per community can be supporting them during this time. And that's really just to weather existing efforts. And as we've identified, and Chelsea just said, there's way more need than even getting back to pre-COVID, status quo for all of us. So this is a huge opportunity. But $1 million, it's a lot of money, but it's also a drop in the bucket, right? I mean, look at what Chelsea just said. We need $50 million, right, to make a difference for our young children. So I think I would open it up for a group conversation. Again, I think there's more priorities than we can all address. And, our families are struggling, our programs are struggling, and, getting reduced and cuts in funding. And so I don't have a straight answer for you. I mean, I have a huge menu that we shared with the municipality early this year. Chelsea and I have also written a proposal for how to better do community-based pre-K in Anchorage. I'm happy to also forward that along, but I wish I had a silver bullet answer, and I do not.
Thank you.
Thank you, Mr. Dunbar. And I guess I'll just say to Stephanie that, we are not the experts in this field. Mm-hmm. So if you don't have a recommendation, we might not have one. So we are actually looking to all of you to say, if we had this much money, this is what we would do with it. And I know that's not easy, but it's not only are you going to have to do that, you're going to have to advocate for it, both for the alcohol tax and for CARES Act money. So I think, I don't mean to be disrespectful, but I think you need to this is what we need and this is why, and people are going to pay attention to that. It's less likely that assembly members are going to say, oh, I think we should spend $4.5 million on this part of childcare that I'm aware, we might not know that that is a need. So thank you for providing us with this expert advice.
Yes. And if I can add, because I do have to transition, and so I appreciate you letting me go early on, but I will just add, we need to be making investments in more family choices for community-based childcare and pre-K in the municipality. $1 million is not going to be enough. So I think if we can combine efforts, if if it's investing in one of the sites Chelsea needs, if it's investing in, one community-based program, but we need more community-based options for families. So I'll leave it at that. And also, again, reiterate my recommendation of, I think this group could maybe talk offline and come up with and provide you with that specific recommendation you're looking for. So I hear your request, but without us, I think we would be stronger and give you better information if we kind of put our heads together to provide that for you.
Great. That sounds awesome.
Great.
Thank you.
Okay.
And
Thank
before we move on, thank you, Stephanie.
Thanks.
Before we move on to the next person, I just wanted to share a little bit that's going on here in the chat. Natasha says, let's fund the 49 million. I'm going to keep hoping. I think we're all with her, many of us. And then there's some conversation about the document that Chelsea shared. This goes for Chelsea and everyone else who has a presentation. If you could send that to us after this meeting, and we'll make sure that we get it up on our website. We like to keep all of the documents that were presented, because if there are members of the public calling in, they might not be able to see it. And then we put it on our website. So if you can just get all final copies of things you're presenting to Suzanne or me, that would be great. Okay, we're gonna go ahead and move on to Susie Pearson from Awake. Thank you so much, everyone. And we're a little behind, but we built in a little wiggle room, so we'll just try to keep to 5 minutes each. I know each of you could speak for hours about what you do and the great things in the community you support, so good luck.
Actually, mine will be pretty brief. So thank you so much to the chair and the assembly members for the opportunity to speak today. My name is Susie Pearson, and I'm the Executive Director of Abused Women's Aid in Crisis, or AWAKE. AWAKE's been providing prevention efforts to the Anchorage community for over 25 years and is committed to ensuring that our community knows that they deserve a life free from violence. AWAKE provides prevention in the Anchorage School District, McLaughlin Youth Center, the Alaska Youth Military Academy, Covenant House, Boys and Girls Club, and all through the community. And so we're mainly working with kids who are in the 3rd grade and higher. Our primary focus is on youth, and we provided services to over 6,000 youth last year, and through our curriculums as far as healthy relationships, safe dates, and Live Respect, which is developed by A Call to Men. Focusing on youth is the key to ending the generational cycle of violence. From preschool through high school, we have the opportunity of captive audience to enhance learning and create foundational skills that build healthy relationships. Current prevention efforts in the community work in a very collaborative fashion, and in order to provide a thorough response to the requests from the committee, I'd recommend that we ask that those gathered allow community experts to help develop a plan that can be presented to the Assembly on how to best utilize these funds in conjunction with the Municipal Health Department. Thanks so very much for allowing me to speak today, and appreciate it.
Thank you so much, Susie. Sounds great. Any questions from my colleagues? Okay. Keely Olson from STAR.
Hi, everyone. Thank you so much for having STAR be a part of this meeting. STAR's mission is to prevent sexual trauma using both primary and secondary prevention strategies, specifically targeting sexual assault, child sexual abuse, and sexual harassment. We have 4 dedicated employees whose sole job is prevention programming. A lot of the work that we do is with the Anchorage School District, augmenting their child safety curriculum and going in by invitation to the classroom. A big focus for us is pre-K through 6th grade personal safety presentations. In middle school, we introduce talking about healthy relationships and consent. In high school, we focus more on consent and what constitutes sexual assault. At UAA, we use bystander intervention strategies, again, using evidence-based and evidence-informed practices. Ultimately, our goal is to prevent child sexual abuse. As was noted, we have the highest rates in the nation. Alaska has a rate that is 6 times higher than anywhere else in the nation for child sexual abuse. We have 2 of our 4 staff currently certified as trainers in the only evidence-informed curricula in the nation called Darkness to Light. that addresses child sexual abuse. The target audience are parents and caregivers, youth serving organizations, and basically provides concrete strategies for preventing child sexual abuse, both in the home and outside of the home. Ideally, we would like to be focusing that at parenting and prenatal classes, especially for first-time parents, really getting that information and those concrete tools out to parents. We also do sexual harassment prevention. We're available to workplaces throughout the community to talk about sexual harassment and prevention strategies. We have contracts with the National Park Service and NOAA, for example, to deliver customized trainings to prevent sexual harassment within our state fisheries and our national parks. You know, another major part of prevention is strengthening the protective factors to build resilience and reduce harm. So I couldn't stress enough what some of the other presenters have been stating about economic supports to families. There is already a mechanism to provide vouchers for survivors of domestic violence and sexual assault. The Empowering Choice Housing Program run through the Alaska Housing Finance Corporation, and that could always use expansion. We have 100 vouchers available in Anchorage. Most of that is funded through a state and federal partnership, but if the municipal government was interested in expanding that, that would be a very targeted approach to assisting families in need and helping them if they're in crisis to help them avoid homelessness, and if they do become homeless to make sure that we have access for rapid rehousing. With those 100 vouchers, we always have a waiting list. We need quality early education. We need quality prenatal care, preschool enrichment and family engagement programs. We need to enhance childcare through licensure and provide early home child visits as much as possible. With each of these protective factors, I can see a place where STAR could collaborate in providing darkness to light training, in providing tools for kids in pre-K, talking with them about personal safety, making sure that parents and youth have a common language so that they can communicate if they feel like they are at risk, if they're in danger, if something is going on that is not safe, that they can talk with their family and trusted adults about that. We have concrete items that we can provide to kids and parents. We have coloring books. We have a variety of different programming that we can provide to parents to help them have those conversations with their kids. I think a lot of people think that it's just something intuitive that parents know how to talk to their children about potential for violence, and it's just not something that most people had growing up, and they don't know how to do it terribly effectively and consistently now without access to training. So thank you very much, and I definitely believe that if we come together as a group, that we can develop a real collaborative approach and provide you with some ideas of how to utilize this funding for major prevention focus in the community. Thank you.
Great, thank you so much, Keely. I have a question from our attorney, Mr. Gates.
Yes, thank you, Madam Chair, and thank you, Mrs. Olson, for your presentation and all the others so far. And we often hear about state of Alaska and our data and numbers, for example, sexual assault rate being high compared to the rest of the nation. But what I really wonder is if we have that sort of data for Anchorage as opposed to statewide. And what's the Anchorage sexual assault rate, for example, as compared to cities our size or so forth? And I realize maybe that data is not available, but it's very helpful, I think, if we have those numbers for Anchorage as well as statewide numbers or rates.
I generally refer to the Alaska sexual offense data that comes out each year after the Uniform Crime Report comes out. So after Western Alaska, over in the Bethel area, Anchorage has the highest rates of violence in the state. But I can't give you specifics. I'm sorry, I'm not at my office, so I don't have them available, but I can certainly provide them for you.
And Natasha is saying that those are in the health department's recommendation, that the policy paper had them in there. So you can look there too. Thank you so much. We are halfway through our presenters. Great job, everyone. And I realized I never introduced myself. I assume most of you know, but I'm Austin Quinn Davidson. I'm the co-chair of the Health Policy Committee alongside Ms. LaFrance. So Leanne Garrick from CITC is going to talk with us next.
Great. Thank you so much for including Cook Inlet Tribal Council on the panel today. I really appreciate the thoughtfulness that went into all the folks that were invited and just getting that input across the community. CITC provides a wide variety of social services in the Cook Inlet region, from education to early Head Start, all the way to residential treatment. And we collaborate with our 8 federally recognized tribes in the region to do so. Of our programs, I want to sort of highlight some of the most important ones when it comes to treatment and prevention. CITC's Child and Family Services program provides crisis intervention and a continuum of child welfare services ranging from prevention to family preservation. We have multiple service areas, including child abuse prevention, family assessment. We have a partnership with the Alaska Native Justice Center to provide Indian Child Welfare Act assistance, intensive family preservation. We work really closely with families that have interacted with OCS and figuring out a way for us to keep those families intact. Our program really stretches that traditional understanding of prevention to include those aspects of intervention that establish the protective factors that Dr. Parrish mentioned earlier. One example of this program is called Laku Canoe, and it was put in place to address the multiple needs families may present to us. It's a whole family approach to help understand and mitigate barriers to service access, emphasizing protective factors for families that may not have that kind of experience or understand how to pull those together, linking services between families and providers so they know they have a network of folks. Our wish is that this results in more connected, healthy, and resilient families, fewer children that are at risk for child maltreatment, and fewer children placed in foster care. And our end goal, we talk about all the time in our meetings, is to create connections for families to move from just barely surviving to thriving. So these families feel very strong when they're in this program. Our Recovery Services program provides a comprehensive continuum of substance abuse and reentry services. We do that through 3 main venues: residential, outpatient, and intervention. And our intervention program includes a section of prevention as well. Our model is a system of care approach, and it uses case management to coordinate that kind of care, and then work therapy to develop those job and life skills training, so that once you've had treatment with us, we can help you sort of re-enter into the community. Of the many programs we provide, some of the most incredible ways that we've made progress are in those projects where we've partnered in new and innovative ways to provide services. Internally, Child and Family Services and recently partnered with our Recovery Services folks to provide an online version of the Enhancement for Strong Native Families, which again really tries to make sure that families understand their values and can continue to provide those protective factors. It's an online training that we provided during the COVID pandemic. We normally did it in person, just in Child and Family Services, and this time we decided to partner with Recovery Services because we had a lot of families that were struggling with alcohol and substance abuse. Doing that together and doing it online, for whatever reason, ended up being so much better. It's resulting in healthier family dynamics, and it's amazing how many people actually are engaging online than they were in person. So there's clearly a convenience and sort of a family scheduling situation going on there too. So that was sort of an innovative partnership. We have a partnership with Awake. Thank you very much, Susie. We have embedded an outreach counselor that is embedded in our Child and Family Services department. Any of our programs can consult with this person. If you came in and you were in an unsafe home and you were looking for a job, or you want to take your GED exam and you did not feel safe, we have folks that will talk with you about that and make sure that you can see that person in our building, just embedded in an area. Very confidential, but it's a way to make sure that your family is safe. So if you come to us just for a job, we can also make sure those family and social structures are in place as well. Another recent example, and this is still in the making, but I bring it up because I think there is a lot of ways that we can partner together across our service lines. It's the start of a project we are considering with Captain Case from the Anchorage Police Department's Patrol Division and our Alaska Native Justice Center, where APD came to us and said that we need some sort of domestic violence diversion. The training we have is 30 years old. Do you have anything? We don't have any kind of cultural competency. And our Alaska Native Justice Center was like, absolutely, we can pull that together. And so this is working on a domestic violence training for first-time offenders to include cultural competency, awareness, and trauma-responsive resources for family members. So again, that role is really to be working really closely together. And law enforcement came to us and said, we wanted to do this really early. We don't want to, do you have any tips for us in any ways that we can partner together early so that we can have some early prevention and intervention to prevent and mitigate future domestic violence and the impacts it has on those families and children. And while these are really small examples, the outcomes and connections that are created when we work across these service lines and community partners are life-changing for our participants. And they really maximize the investment that we can all make in terms of our capital and human resources. So CITC encourages this committee to consider the amazing things we can do when we work together and strategically. I think we could each tell you what we could need organizationally, but to make a bigger programmatic impact, it's really going to take all of us together, working together quickly, efficiently, but with really good data and really good plans to kind of figure out how we can work closely together and knit ourselves together. With this more focused planning time, we have the opportunity to make these services transformational, not just transactional. In addition to those positive outcomes for children and families, the organization of these ideas and the distribution of funding has the opportunity to demonstrate to the general public, especially those who voted against the alcohol tax, how this investment in prevention and intervention and treatment contributes to a stronger community as much as our first responder partners.
Excellent.
Thank you.
Thanks, Leanne. Really appreciate those comments, and Natasha's weighing in as well. So we have 4 speakers left. We want them all to have plenty of time, and then we'll do a little bit of closing comments at the end. So let's try to stick to 5 minutes. If it's 6, 7, that's okay, but please be cognizant, and I might start cutting people off if they go beyond that, just to make sure we respect everyone else's time. So April from South Central.
Thank you, Madam Chair. I'm going to try to talk really quickly and get lots of information in 5 minutes. I just want to start by saying that
it's an unfair amount of time. I'm so sorry.
It's okay. It's okay. Happy to have it. I appreciate the committee's interest in hearing from stakeholders in the community about the work that we could be doing. It's an exciting opportunity to have the conversation. South Central Foundation, as you know, is an Alaska Native healthcare organization owned by the Native community. We serve 65,000 Alaska Native American Indian people, and our hub is here in Anchorage, and most of the people who we serve, the largest population is here in town. I serve as the Vice President of Behavioral Services for South Central Foundation. I am born and raised here in town in Eagle River. My family is from Nelchik, where I'm a tribal member. I'm Athabascan. I want to just start by sharing a really quick story. You may know that SCF operates a residential treatment program for youth called the Pathway Home, and we're really proud of the work that we do in that program. And maybe about 3-4 years ago, myself and the leadership team were doing some planning, and we had just this feeling that we needed to talk about what we could have been doing in the lives of these kiddos and their families 10 years earlier or 15 years earlier? What might have been the intervention that could have allowed us to walk beside a family and change their path so that they might not have needed residential care? And the question, I think, is, are we doing enough of those earlier interventions? And I want to share with you some of the positive things we're doing. But most importantly, I want you to hear how hard it is to fund that work. It's actually really hard to have sustainable funding so that if an intervention works, if it has good outcomes, it can be a part of our community in the long run. So first, kind of some of the examples of things that are really exciting that do work. You may know South Central Foundation has a program called Family Wellness Warriors Initiative, which is ending the cycle of domestic violence, child abuse, and child neglect in this generation. It's an amazing program that helps people have a safe place to, through the power of story, understand how their life experiences impact how we step forward as people. Great outcomes, ending cycles for families between generations, but really hard to fund. It just isn't considered healthcare, and it isn't paid by Medicaid. So you end up trying to scrape together dollars to figure out how to provide that intervention. Similarly, we have a mother-baby program called Nutoxivic, where we want to identify families and do in-home work. It's a nurse-family partnership with a behavioral health addition. And we used to try to do that for a wide range of families, but the funding is so hard to secure that it's become more and more narrow over time. And we're serving really high-risk families, but we know that that early kind of partnership in-home intensive intervention could serve more people if we could figure out how to fund it. We do a variety of learning circles, which are the way we create space for people to come together and learn and grow from each other. So learning circles like Family Matters Night, and opportunities for families to learn to play, so toddler time and snuggle time, great interventions, but they don't fit the kind of put a bill on it and get paid. So how do you fund something like that? And then, finally, I want to talk about how we're trying to reimagine what kind of a primary care intervention should be around having a baby. And thinking not just about the medical model and physical wellness of mother and baby and birth, but rather imagining physical, mental, emotional, and spiritual wellness of the person and the family. And how can we adjust our thinking from that intervention being preconception, conception, before you have your baby, after you have your baby, in those early years, and build around that system a way to walk with families through that transition. And I think we can do that. We have pieces of it, but it's really not how we're paid. And so if you want to invest in the behavioral health aspects of the change from individual to having a baby to family, we've got to figure out creative ways to fund that. And we also have to be able to identify when a particular family is at higher risk and needs a higher level intervention. So maybe if there's addiction in the family, we need access to addiction treatment, and we don't always have access to the treatment. So there's all the specialty interventions, and we don't have all of those. But if we could invest in the earlier interventions, the preconception, conception, before you have your baby, and those early years, and raise our collective community competency around early child mental health, that's the path that we're on at SCF. I think it's really exciting. The challenge is it's really hard to fund, and you end up funding it with this mix of sort of grants that are time limited, and each grantor has a different reporting requirement for you, and you end up piecemealing, and you find something that works, and then the funding goes away. So this opportunity that we have with the reoccurring alcohol tax money to bring together providers to come up together with community interventions and then test them and then see them walk forward in community when they work, I just think it's super exciting, and I appreciate Madam Chair the time, and I think I'm at like 6 minutes, so almost on time.
You're doing great. Also, just really inspiring. I appreciate your thoughtfulness and thinking sort of big picture. And yeah, Natasha and Suzanne and I have a little chat going on the side, just so how lucky we are to have such incredible community partners who are so dedicated to their work. So thank you. Sherry, you're up next from Volunteers of America. And Sherry, you're muted.
Hi, can you hear me?
Yep.
Okay. Can you see my screen?
Yes. Sherry, are you talking? You could be muted again. We can't hear you. I don't show her muted on here, but I can't hear her. I assume no one else can hear her. Can someone let me know if you can?
I cannot hear her.
Thank you, Felix. Interesting. Oh, is that her? Sherry, are you back?
This is April. I'll send her a quick text.
Okay, thank you. And we could have Renee go in the meantime, but since her screen is up, I don't know how to take that down.
Oh. That's okay. I'm not presenting, so it would be fine if you want me to go.
Yeah, why don't you go ahead and then we can try to sort out what's going on with Sherry. Oh, she's trying to get back in. Okay, go ahead, Renee. It's fine.
Okay, well, I echo the sentiment of the other community partners. I've just been really impressed by the presentations and the opportunity to partner and the dialogue around being able to plan together and to really look at how do we have a longer term vision that supports the efforts that are being discussed. They're super inspiring to me. So I just want to start by saying that. And then my name is Renee Rafferty. I'm the Regional Director of Behavioral Health for Providence, Alaska. And Providence has services in Anchorage, Mat-Su, Valdez, Kodiak, and Seward. And while we have a broad range of healthcare services, my scope is over behavioral health services. And what I wanted to talk about today is some success that we've had in Kodiak particular, and the partnerships that we have with Volunteers of America. Volunteers of America and also the Anchorage School District. And it's a project that we're building from a model that we've had prevention success in Kodiak. So we have school-based mental health counselors that are placed in, and we're placed in elementary, middle school, and high school, providing intervention, tier-based intervention from overall wellness training, intervention with teachers, integration into the school faculty, as well as intervention for kids that are experiencing emotional distress linked to adverse childhood events that we've been talking about. And that early intervention with families and teams wrapping around the child. And with that program being in place, there has not been a suicide by a youth in 10 years. And we know that building on that within our larger system, we have many school-based mental health programs that have that real wellness approach, trauma-informed care that in Washington, California, and in Oregon to build from. So we have a lot of great expertise in our teams, and we've been able to show the benefits of school-based mental health care to be, a positive school climate, decreased students leaving school and not completing graduation, improved student behavior, decreased stigma associated with mental health, which I think is a true prevention effort. When people can see that mental health is just integrated into the academic environment, people feel as if they can continue to care for their mental health openly and with support, and the opportunity for better academic performance and increased opportunity for families to seek services and be linked with specialty behavioral health services. I think one of the things that's very exciting about this is that it's not fee-for-service specialty behavioral health. It's really the opportunity to provide prevention while we can bill for about 20 to 30% of the work that's done. The other 70% requires ongoing funding. And if we think about this in terms of suicide prevention and access to healing from the trauma that's already happening within our society, I think it fits in really nicely with the work that's already happening to be ongoing prevention for earlier within family systems. And I know that one of the things that we've seen in states that have been very successful in this is that they've seen fundraising as well as government participation in long-term planning for this, that really, if we rely on fee-for-service, the medical community, there's not sustainability. And if we've made a business plan for the next 5 years, and the expansion looks like $1.1 million to serve 12 schools within the Anchorage School District, and that's with no other funding from other sources. And so what we look at, and that's per year, 1.1 million. So I think that, that's a small pilot project to start, but it can allow us to see the outcomes from early intervention and treatment of trauma. So stop there and let Sherry go. Thank you.
Thanks so much, Renee. Sherry, you're up. Hopefully we'll hear you this time.
Great, thank you so much, and thank you, Renee. I think me and Teams don't get along, so I'm not going to pull my PowerPoint up, but I will send it to you. It breaks all the rules of having too many words on there because there's so much to say around this, and distilling all of this work into 5 minutes is a welcome challenge. Well, I want to echo what all of the speakers have talked about in terms of the real opportunity we have here to focus on prevention, that it's often easier to focus on the symptoms or short-term projects. For instance, I'm referring specifically to camp abatement or focusing on shelter and short-term wins, when really we have an opportunity here as a community to focus way upstream in pre-K, early childhood, some real amazing opportunities there. So I appreciate this group having that message loud and clear around the opportunity to use both this tax and CARES Act funding to really change lives long term, which requires a little bit more patience and a little bit more focus. So just a little bit about VOA. We really, our services are centered around youth. We've been here in Alaska for 40 years, and really it runs the spectrum from behavioral health prevention, early intervention, affordable housing development, homeless services, and substance abuse and mental health treatment. And so having a foot in all of those worlds, I think, gives us insight into, as others were talking about, how did we get to this point and how could we have intervened earlier? So 2 things I wanted to talk specifically about today was our kinship care program and our school-based behavioral health services, as Renee spoke to. And really the reason why I'm highlighting those 2 is not necessarily because I'm wanting you to focus on funding those. It's just as examples of prevention and things, the types of things that you can do with a prevention focus. So overall, we're really thankful for the tax because we know that tax as itself, as a policy, can have benefits in terms of reduced consumption. So we're really, really excited about that. When it comes to kinship care, as an example, in VOA's kinship care program, we're relatively small. We're the only statewide program that offers some services in communities across the state. And we're trying to provide these families with services that they might not have access to because they're not a licensed foster care provider. But we know that the outcomes associated with relative caregivers in terms of increased well-being and health and development can look better with individual households. So our recommendations around that is just to think about caregivers in a broader sense, as many have mentioned here. It might be a birth parent and it might be a relative, but having those caregivers to have the support that they need as early as possible is a real intervention opportunity. We've seen some data, and you may have seen some data that came out recently around the Youth Risk Behavior Survey that showed that the suicide rate has doubled, almost doubled in the last 12 years. And so that's something that is a real shocking issue that we have to address in our state. And really the only way to intervene is to start much earlier. And so some of the things that have been mentioned before is strengthening families, and I just want to echo support on that. And school-based behavioral health services as a prevention and early intervention. We are in 4 schools now. We're very excited to be partnering with Providence and the school district to expand that as much as possible, because we see that right now mental health is a huge need for youth in our community, and focusing on screening, brief intervention, and referral for care can be a real intervention opportunity. So lastly, I wanted to just talk a little bit about, in my last 30 seconds, is around our homeless services as an example. I know that that's a topic in the community right now, and focusing, my recommendation is to focus on actual housing interventions, if that's something the community wants to do, and not patching or focusing on symptoms. So prevention and diversion and actual housing interventions. And then in closing, I know I've been a little all over the place. I'll send you the PowerPoint. But what we've seen in terms of COVID nationally and in Alaska is an increase in alcohol consumption, an increase in mental health symptoms. And we anticipate that we have a wave coming of need. And so I want to echo what everyone has said, is that this is a real opportunity for this group to focus upstream and to focus on prevention and diversion. And I know that this group will be able to get together and come back to you with a series of recommendations that are very concrete, because I know that's what you're looking for. So thank you so much for the time.
Thanks, Sherry. I appreciate that. And we have one more presenter, Trevor Stores from Alaska Children's Trust. Go ahead, Trevor. Trevor, you're on mute. If you're, I don't think you're on the phone since we see you. Oh, there you go.
Can you hear me?
Yes, we can.
No longer muted. Whoops.
Can you hear us?
Yes, you can hear me.
Yes, we can.
Okay, too many buttons to hit. Well, good afternoon, and thanks for this opportunity to present to you today. As mentioned, I'm Trevor Stores, President and CEO of the Alaska Children's Trust, the statewide lead organization focused on the prevention of child abuse and neglect. It's important to share that I recognize the complexity that's associated with the concept of preventing child abuse and neglect. Unlike polio, there's no singular cure. And that's very evident from our discussion today and the many ideas that have been presented to you around multiple issues. However, as Dr. Parrish shared in his presentation, we know what some of the overarching influencers are that put a child and family at risk of child abuse and neglect. It can be very overwhelming, and at times, this complexity can cause people to not invest in primary prevention, but rather support programs that mask the issue or just touch the surface. I've heard suggestions about reducing the amount of funds supporting prevention to support other aspects of Prop 13, but such a decision would be detrimental to the work we're all trying to achieve. As we determine how best to utilize these funds, I encourage us to remember to not only feed the line, but to also shorten the line. In other words, we need to invest in primary prevention. As they say, go upstream. As I say, go so far upstream, we stop the glacier from melting. If we don't shorten the line, history has shown the line will just increase. And as time passes, the rate of increase will in itself also increase. That is why we intentionally ensured prevention was a key aspect of Prop 13. And that is one of the reasons why Anchorage voters supported it. My goal today is not to recommend specific programs. I think the speakers before me did an excellent job of doing that. My goal is for the Assembly to can fund utilizing Prop 13 Rather, to share with the Assembly the Alaska's Children's Trust's willingness to host a convening of the experts, all of who you have heard today, and several others who were not able to speak today, to develop a detailed plan of recommendations for the Assembly. The complexity of preventing interpersonal violence like child abuse, neglect, and domestic violence cannot be figured out in a few 5-minute presentations or a town hall meeting. The funding generated by Prop 13 is giving us, for the first time ever, as a community, the opportunity to be intentional and innovative in our work. It is not the opportunity to just fund what has been happening, but what could be happening. The Alaska Children's Trust will utilize the CDC's Essential for Childhood framework to gather experts and use data to inform solutions and recommendations to how best utilize these funds for short-term and long-term success. Essentials for Childhood framework outlines 5 broad categories that create safe, stable, and nurturing relationships and environments for children that result in a reduction of child abuse and neglect. They are strengthening economic supports to families, ensuring households have financial security, change social norms to support parents and positive parenting, provide quality care and education early in life, like pre-K, and improving quality childcare, enhancing parenting skills to promote healthy child development, and intervene to lessen harms and prevent future risk. The convening will develop a plan of recommendations based off this framework, rooted in data and outlining the evaluation process. The Children's Trust funded nearly 50% of the Prop 13 campaign, not because we saw the potential funding as a way to sustain the status quo, but as a way to develop a coordinated effort between the municipality, nonprofits, tribal entities, and the community at large to get to the heart of the issues and try and truly prevent child abuse, neglect, and domestic violence. Although the potential funding is approximately $3 million, it is a drop in the bucket. It is vital that we use these funds very intentionally and leverage these funds. And as we all face the racial tensions in our nation today, I would be negligent to not mention we need to ensure our work utilizes a strong equity lens, and this does not occur in these 5-minute presentations. I applaud the Assembly and my partners that spoke today, and for us to and all of us endorsing Prop 13. Passing Prop 13 was the easy work. The hard work is now determining how to ensure these funds, how these funds truly can be impactful in a coordinated manner. The plan will outline a process of how to utilize the funds, process to disperse them, and how we have ongoing evaluation, and that it's coordinated. Anchorage's future prosperity depends on our ability to improve the well-being of the next generation, and how we invest these resources greatly influences the success of our children. Thank you for this opportunity, and I look forward to bringing that plan and recommendations to you at your July meeting.
Thank you so much. Would you mind turning the sound? It's echoing because we're there you go. You did it. Thank you. Just wanted to say thank you on behalf of Suzanne and Natasha as well for your comments and for everyone's work and comments today. I wanted to bring up, just in case anyone felt restricted by this, that while $3 million has been mentioned, or I think 3.6 was the most recent recommendation, so all the sponsors for the alcohol tax, Mr. Rivera, Mr. Dunbar, and I got together with the administration and put together a vision of what we could spend the money on. It's estimated to be a little bit below 12 million in 2021. We won't start it until February 1st. And so once we get into 2022, there'll be that extra month of funding, could be around 13 million. We divvied that up within the 3 categories and suggested that we spend 3.6 on evidence-based grants and early education. That was just a suggestion made by the 3 of us and the administration. That is in no way what it might turn out to be. It could be or could not. And so I think we should, for instance, the Homelessness Committee last week or the week before presented a potential plan where they spend $6.5 million and reduce our money in our bucket 2 down to, and I realize there's some overlap with the treatment and such, but down to, I think, 1.5. I can't quite remember at the moment, but I guess I just want to say that we can think big, we can argue for a different number. What we should be doing is identifying the need and trying to fill what we can with that money. And so anyway, thank you all. I mean, like Trevor said, and like many of you, I just think this is a really unique opportunity to actually look toward the future and change the trajectory of people's lives and reduce the corresponding social ills that we've, for years, we spent millions of dollars to treat or react to. And we have a chance to make a really smart economic investment that will help our neighbors and save lives. And the best investment, I believe, we can make is in prevention. And I hope that we as a group are able to argue that to my colleagues. And we essentially need 6 out of 11 of us to agree with that. And that will be our goal over the course of the next couple months. Trevor alluded to a July meeting. We'll have a July health policy meeting. We haven't shaped exactly how that will go. Our plan was to hopefully present a more focused plan / proposal, like one that we've sort of all been discussing on this call. So we will work to come up with next steps before that meeting. And then Trevor alluded to town halls. We're having town halls in August. And with the public, I expect that a lot of those town halls, you will hear from the public who want camps cleaned up and want things that they're seeing in front of them to go away. And while that's compelling, I don't think it solves the problem. And so we're really challenged to tell that story to our colleagues and get them to have the vision to work on prevention. And with that, I will see if Ms. LaFrance wants to say anything. Ms. LaFrance, did you want to add anything? I think she's good. We're going to skip number 4 on our agenda, which is the legislative priorities and budget items for 2021. We're working on those, Suzanne and Natasha and I. Feel free to send us information or ideas, and we can continue discussing that in July as well. But we'll work to put some initial thoughts together for our Rules Committee discussion on June 26th. We have a couple minutes for audience participation. Do we have any members of the public who want to participate?
Yeah, this is Eugene Haberman.
Thank you, Mr. Haberman. Do we have anyone else? Okay, Eugene, you have the 2 minutes that we have left. Go ahead.
My name is Eugene Carl Haberman. I represent myself. I live in the Master Valley. I follow the public process. When the public process is done appropriately, the decision made by the governing body is more like the public interest. Just a footnote, just before the end of the last meeting of the Assembly, for this one, I made a note that the information that you have there is not available. Your particular committee doesn't have a website section for putting that information on versus the public safety. So the public was going blind to the presentations about what was being presented as far as documents. I heard you say, reference early during the meeting, that you'll put it on a later date somewhere. But the fact is that information need to be available, and your particular committee doesn't even have a web section like the public safety. And then a note 2 is there was difficulty knowing who was really speaking, and particularly is some of them were being recognized, and you had first names only, not full names, and some of them I had to decipher who are these people, who do they represent, and it's very vital for when a person's being recognized, you need to note who they are, what organization, and their first and last name. So some of them did that. You did it sometimes, but it was I was walking blind to this whole thing. And thank you, and I wish you the best.
Thanks, Eugene. Good reminder to make sure we're identifying ourselves. Okay, well, that's it. We're going to go ahead and adjourn, and we'll look forward to continuing this discussion into our meeting in July. Thank you all.